Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Augmentation. So what will happen after your breast augmentation? So breast augmentation is a day case procedure. You're normally in and out the same day. When you wake up in the recovery area, some patients describe some discomfort, many patients are comfortable. Some describe it as feeling like somebody sitting on your chest, but of course there will be some discomfort from this procedure. It should be adequately controlled with standard pain medications that you will take home with you. You'll wake up wearing a bra, and I advise you to bring a bra with you, typically of the cup size that you're expecting to achieve, and you'll be guided with regards to this. I suggest you get 2 bras to wear, non-underwired sports bras. The purpose of these are to stop the breasts moving around in normal activity, to allow it to be comfortable and to prevent the implants from displacing. You'll need to wear these for 6 weeks, day and night, so make sure you get 2 comfortable bras. Initially, the breasts will be swollen after the surgery for the first few weeks. You'll look at them and the nipples will stick out and you'll think, wow, I love these bazookas. But actually, over a period of several weeks to a few months, the breast will relax back into a more natural position and more natural looking shape. I always try and give a natural looking shape, and I don't want to try and give round, stuck on appearing breasts if I can help it. What can happen after your breast augmentation? The scars will be red for up to a year, and sometimes they'll go through a phase of being lumpy. Theoretically, there is a risk of keloid scarring. That's a big, thick lump of scar that will continue to increase in size and will require further treatment to deal with it. It's fortunately very rare, but it is something that could happen. Stretch marks can be a problem if you use very large implants in small breasts. This is not something I advise or try to suggest, but I have seen it happen on one occasion. If you don't want to feel the breast implant yourself, then don't have a breast implant. You will always be able to tell where the implant is in your body, and over time you'll be able to feel the edges of the implant, usually around the side of the breast, or sometimes when you lean forward you might see slight ripples or puckers in the skin that show the implant is there. No one else would be able to feel the implant. It would feel like natural breast to anybody else, but to yourself, you know your own body and you'll be able to feel the implant there. Most women's breasts are slightly different from one side to the other, and I will guarantee that they will remain slightly different in spite of implants being placed. There's no way I can make breasts look exactly the same on each side, especially if there are pre-existing differences. Sometimes the differences can be made smaller or less obvious by placing breast implants. Sometimes small, fairly innocuous differences can be made more obvious after breast implants. Occasionally drains are required with breast implant procedures. This is if I'm concerned that there may be fluid accumulation around the breast in the post-operative period. If this is the case, a drain will be placed, you'll be kept overnight and the drain removed the next morning. In the majority of first-time breast implant patients, this will not be needed, but in those patients having their implants replaced, then the drains will need to be required, because in many occasions quite a significant amount of fluid can be generated by the removal of the capsule around the breast. After surgery, the nipples may change in sensitivity. Usually they're quite numb, and this will restore itself over a period of a few weeks. Occasionally the nipples can be more sensitive. Sometimes these changes in sensitivity can be permanent. After breast augmentation surgery, many women report unusual shooting pains or unusual sensations in the breast for years down the line. This is quite normal and nothing to be concerned about. What significant complications can occur after breast implant surgery? Infection can occur. If it's an infection on the surface of the skin, this is normally something that can be treated with oral antibiotic tablets, and this should settle down. However, an infection around the implant is a disaster. Should you get an infection around the implant, then the implant will need to come out. attempts to try and treat it with antibiotics are usually fruitless, resulting in scarred, hard breast tissue. This means there'll be a period where the implant is out and you have one breast for a while, and then usually 2 or 3 months down the line, the implant can be replaced to restore things back to normal. Bleeding can occur after surgery. This would manifest as pain, swelling and bruising coming through to the skin of the breast. You'll need to be taken back to theatre as an emergency, the implant removed, the bleeding stopped, everything washed and the implant replaced. This shouldn't affect the long-term outcome to any significant degree, but it will certainly make your post-operative recovery slower, with more swelling, more bruising and a slower return to more natural breast shape over time. There is a small risk of clots on the legs. You'll be given special stockings to wear and a machine that pumps your calves to stop this, or rather reduce the risk of this. However, in spite of all these precautions, there always remains a small risk of a clot forming on the leg, or this embolizing to the lungs a couple of weeks down the line, causing breathless issues and needing to be admitted to hospital for treatment. The implants themselves also have complications. All implants will form a capsule, whether they're hip joints, heart valves or breast implants. The capsule is a layer of scar tissue around the implant. It's a way of the body saying, I don't really know what's here, I'm just going to seal it off from me and try and ignore it. In the majority of implants, such as hips, if a capsule tries to contract, it's not an issue. But in a breast implant, because a breast implant is soft, as a capsule contracts, it will tighten and try and make the breast implant form a sphere. This will be manifest as a hardness to the breast, as well as a change in shape, although it occurs very slowly over time and many women don't notice for quite a while. Should you have capsular contracture, you'll need surgery to break the capsule, remove it, and a fresh implant will need to be inserted. Up to 10% of women can get capsular contracture over time, although in my own experience it tends to have been women presenting who've had implants for a long period of time that are simply worn out and require replacing anyway. You can think of it as the implant telling the body it's time for it to be replaced. Implants have a finite lifespan. They are meant to last around about 10 to 15 years at the most. So therefore, if you're planning on implant surgery, then you're committing yourself to further surgery down the line, not just this one operation. At the very least, the implants will either need to be removed, replaced, or breast uplift required, and of course you'll be expected to pay for all of this. Implants can move after the surgery. This is why we put you in a tight-fitting sports bra and advise you not to do any upper body exercises in the early post-operative period. They can move slightly up, down or to one side, and this may manifest as asymmetries. Sometimes in the early phases this can be pushed back into position, but in the majority of cases it may require surgery to replace the implant into its proper position. In the majority of cases the difference is so subtle as to not make this worthwhile. Implants can leak, rupture or extrude. All of these are technical terms that essentially mean that the implant is failed and needs to be removed. Given that they are manufactured items, there is a small proportion of implants that can have failure or have manufacturing defects, or implants can be damaged as they're being placed into the body. Damaged implants need to be removed and replaced with fresh implants. Many implant manufacturers give you a guarantee relating to manufacturing defects. Back in the 80s there were a series of journal articles suggesting that breast implant silicone was related to rheumatoid arthritis. Larger population-based studies subsequent to this showed this not to be the case. However, more recent meta-analyses, that is, studies that look at many other studies and group all the data together, suggest there may be something in this. However, these studies also show that breast implants reduce your risk of lung cancer and fibromyalgia. Obviously, the implants themselves don't do this, but may be something to do with the general populations that have breast implants and their lifestyles. These studies show very small changes, and therefore this may or may not relate to you. There is definitely a subgroup of patients for whom implants do not work well for them, creating all sorts of vague symptoms such as sleeplessness, depression, scalp irritation and so forth. This doesn't mean these patients have not a real problem. It's just not something that doctors can diagnose or put a particular finger on, and we call this breast implant illness. These patients often have improvement in their symptoms when the implants are removed. there's no way of knowing whether you would be somebody prone to breast implant illness until the implants were actually placed inside you. Do implants cause breast cancer? The answer is yes, to some extent. All implants will cause a cancer. Placing a solid implant in a rat in an experimental model has a 1 in a million chance of developing a small sarcoma. So there is always a small risk of cancer with any implant. Do breast implants actually cause breast cancer? No. The standard female risk of breast cancer in the UK is about 1 in 10 if you don't have breast implants, and this isn't significantly increased with breast implants. Would breast implants delay your diagnosis of breast cancer? It is possible, but studies have shown that the delay would not be enough to change the outcome from the diagnosis. There is a new type of cancer related to breast implants called breast implant associated ALCL. There's an article on this on my website, and essentially this is not breast cancer as we typically refer to it, but a type of lymphoma that is situated in the breast in response to the implant. We don't really know what causes it, but the theories at the moment revolve around there being a chronic inflammation related to the texture of the implant. When you look at this implant, it's got a grain to it, which we call the texture. Texture in implants was used to reduce capsular contracture. Smooth implants have a higher risk of capsular contracture. The risk of BIA-ALCL is in the region of 1 to 2 to 300,000. So it's a very small risk when you compare it to the risk of breast cancer. Nonetheless, it is a very important risk. It is a curable cancer. If you show symptoms of it, it can be treated by removing the breast implant and the capsule which contains the lymphoma around it. In the majority of cases, this is curative and no further treatment is required. Many patients will then ask, well, should I have textured implants or smooth implants? And I respond that it's typically to do with your assessment of risk and how you respond to that. If I think of members of my family who've had lung cancer and breast cancer, then no one else in the family would want to take that small risk of having a lymphoma associated with breast implants. On the other hand, a younger patient with no family history of cancer may think, well, on the other hand, the risk is very small. I'm much more likely to get regular breast cancer anyway, and I'm not willing to go through further surgeries to deal with the capsular contracture that is more likely to occur with smooth implants. There's no right or wrong answer, and I'll do my best to guide you in a consultation depending on your personal circumstances. You can download a leaflet from the American Association of Plastic Surgeons from my website that also outlines some of the issues associated with BIA-ALCL. Aesthetic complications of breast augmentation, so complications associated with the appearance of it. So I say to all patients that I guarantee there'll be differences between the two sides. There's no way that I can make the breast look exactly the same. Most women will have a difference between the two sides. One patient said to me they're sisters, not twins, and I think that's a really good analogy. So I often say to patients, I will guarantee asymmetry. This should be within normal limits and should not be grossly abnormal. If that was the case, then something would need to be done. Synmastia occurs when the breast implants are placed too close together. Often you leave anywhere between 4 centimeters or so between the breast implants in order to make sure there's a gap between the two breasts. When I'm placing breast implants, I'm generally trying to place the implant under the center of the breast. So if you can imagine the nipple being the cherry in the middle of a Bakewell tart, you want the breast implant to sit fairly centrally in the breast. If you have breasts that are quite close together, then I would use a smaller implant to make sure the breasts don't form one synmastia. If your breasts are quite wide apart, then you'll have a gap between the two breasts. Many patients want a cleavage, and I explain to them if their breasts are widely spaced, to achieve a cleavage you need to use a good fitted bra. So conversely, you can get synmastia by using very uplifting bras, and that's not because of the implants, that's just because of the style of clothing that you wear. In this day and age, when we're taking photographs of one another and sending them or chatting over video, it's important to look good all the time, but at the same time we can't make your breast look perfect at every angle, in every lighting, in every photograph. Breast augmentation surgery is there to make your breasts look larger. It cannot make them look perfect in every situation. That depends a lot on the clothing that they wear and the position you stand and how you take your photographs. So there's no way that we can use surgery to make things look perfect all the time.